Most pregnant women are just told to do Kegels to prepare their bodies for pushing. But really, what pushing requires is your pelvic floor to relax, lengthen, and get out of the way to have a smooth labor. I'm Dr. Mae Hughes, a pelvic floor physical therapist, mom of 2, soon to be 3, and today I'm going to walk you through 4 different techniques to better prepare your pelvic floor to hopefully reduce things like perineal trauma and improve your overall labor experience. Now, before we get into those 4 different techniques, let's provide some context about what's actually happening to your pelvic floor while pushing. So your pelvic floor, which is a group of muscles at the base of your pelvis, really needs to lengthen anywhere from 1.5 to 3 times its resting length during a vaginal delivery. That is a lot of stretching that is going on at your pelvic floor. And it's not just your pelvic floor stretching, but it's also your breath work that is working with your pelvic floor as well. If you are doing things like holding your breath and generating a lot of tension, that is also going to create a lot of tension in your pelvic floor, making it harder to push out your baby. Think of it like this. A pelvic floor that can't relax is like your baby trying to push their way through a closed door, rather than a nice and open door that is able to move out of the way. And pushing isn't just about your pelvic floor, though it is a large part of it. Pushing is also about your breath, your hips, the position you are in, and the ability of your pelvis to open in all planes of motion. Technique number 1, using your breath to learn how to lengthen your pelvic floor. So your diaphragm, which is your breathing muscle, sits at the base of your ribs, and it acts like a piston system with your pelvic floor. So your diaphragm sits on top, pelvic floor sits on the bottom. And when you inhale, that diaphragm descends and lowers, and in order to maintain that pressure system, your pelvic floor must also descend, lengthen, and lower. So they both lower together on an inhale, and then on an exhale, they both reflexively lift up and in. That inhale is what creates space and length in your pelvic floor. So if you never learn how to properly inhale and expand and lengthen and descend your diaphragm, you're never getting that full lengthening of your pelvic floor during pregnancy as well, which is going to lead to a lot of tension in your pelvic floor. And that's also why performing endless Kegels is not the move for birth prep. Instead, I want you to focus on 360-degree breathing, where you're inhaling through your nose, trying to expand your ribs 360 degrees like this, and then exhale, just blow out that air, let it all go. No contraction of your pelvic floor, no lift, just learning how to inhale and lengthen, and then exhale, just allow that piston system to reflexively lift. One of my favorite positions to practice this breathing technique in is child's pose, where you're sitting back on your heels with your arms extended, and you're trying to breathe into that back body, almost that bra strap region, and feel your lower back and sits bones expand and lengthen. Your sits bones are your ischial tuberosities, those bony prominences at the bottom part of your hips. So when you inhale, you should feel this space between your sits bones expand and lengthen, almost as if you are breathing into your butthole. I know it sounds silly, but it's actually a really great cue. If you put your hand on top of your butthole when you inhale, you should feel a little bit of pressure into that area, and that's how you know that you're getting the good expansion that you need. Technique number 2, creating space in all 3 levels of your pelvis. So quickly, your pelvis actually has 3 different levels: the pelvic inlet, which is the top, the mid-pelvis, which is the middle part, and the pelvic outlet, which is the bottom. And they all open with different types of movement. Pelvic inlet opens best with hip external rotation. Mid-pelvis opens best with asymmetrical movement. And the back part or bottom part of the pelvis, your pelvic outlet, best opens with hip internal rotation. And that's why it's important to incorporate mobility, not just of your pelvic floor, but also the surrounding hip musculature that attach onto different parts of your bony pelvis, because if the hip muscles get really tight, they can actually pull your pelvis into different positions, which can decrease the amount of space in different parts of your pelvis. Some of my favorite exercises to open the pelvic inlet are cat-cows, and pelvic tilts. Some of my favorite to open the mid-pelvis are going to be adductor rockbacks and rocking lunges. And then my absolute favorite for opening the pelvic outlet is going to be a quadruped rockback with your feet slightly wider than your hips. Technique number 3 is to push in positions that actually allow your pelvic floor to expand. So the common position that you will see women pushing in the movies is the lithotomy position, where you are flat on your back, your feet are in stirrup, maybe your knees are really wide. And this position is actually one of the worst positions to push in to open up your pelvis. And the reason is that when you are flat on your back, the bottom of the hospital bed, wherever you are, is actually pushing into your sacrum. And when you are pushing, remember, this is the pelvic outlet, you want to create more space in your pelvic outlet. And that requires bringing your hips together to create more hip internal rotation, but also for the sacrum to extend back a little bit. This sacrum right here, this triangular bone, needs to extend a little bit to create the most space in your pelvic outlet. You can imagine it's really hard for your sacrum to move if it is flat against the floor or hospital bed, pressing and reducing the amount of movement that you can get. So that's why I really recommend trying to practice in different pushing positions, such as side lying, where you bring your foot out wide and have your foot slightly higher than the height of your knee. You can have a nurse hold your leg or whoever's in the room with you. And yes, this is a position you can get in with an epidural. Another position is all fours, where your feet are going to be slightly wider than your knees. You can be draped over a ball, or you can just be supporting yourself. I personally, in my second birth, pushed on my forearms just like this. And so it just allows for more sacral freedom to create the most amount of space in your pelvic outlet as possible. Now, if you find yourself in a position where you have to push on your back, I recommend elevating the head of the hospital bed and don't put your feet in stirrups. Instead, when you're in that reclined position, bring your feet slightly wider than hip width. You don't have to bring your knees all the way together, but bring them in slightly closer than your feet, and maybe even put a towel roll underneath of your booty to allow more space for that sacrum to move. And technique number 4, learning how to open glottis push. If you've ever heard of purple pushing, that is where you hold your breath. They maybe coach you to count to 10, and then you're just gonna push down as hard as you can while holding your breath. And while yes, this method does work most of the time to successfully deliver your baby because it generates a lot of intra-abdominal pressure, it also can create a lot of pelvic floor tension, because when you hold your breath, try it right now with me at home. When you inhale and then hold your breath and try and bear down, do you feel how you naturally squeeze and tense and lift your pelvic floor up and in? So once again, think about that tense pelvic floor. It's really hard for your baby to navigate through a tense pelvic floor. So that's what is actually called closed glottis pushing, because you're closing off your glottis, you're holding your breath, you're bearing down and pushing. I, as a pelvic floor physical therapist, like to coach open glottis pushing. So this is where you take that big inhale, belly expands, and then instead of holding your breath and pushing down, you're going to exhale as you bear down and push. I like to use the cue big belly, hard belly. So you inhale, keep the belly big and hard as you then exhale and bear down. Now, the reason they don't teach this in the moment during labor and delivery, maybe one, they're not well versed in it, whoever your providers or labor and delivery nurses are, or number 2, they haven't seen it done successfully, or number 3, it's really hard for them to coach and cue in the moment. So that's why I recommend practicing this beforehand. So let's practice in all fours together right here. You're going to inhale through your nose, expanding the ribs and belly. Remember, use the cue big belly, hard belly, and then you're going to exhale, keeping the belly big and hard as you bear down. Now, it's not super intuitive, because normally during pregnancy when you exhale, you're gently lifting your pelvic floor up and in to engage your deep core, or you're just exhaling and doing nothing with your pelvic floor. So the idea of bearing down and kind of pushing down and trying to make your holes bigger of your pelvic floor is not as intuitive as you might think, which is why I really recommend trying to practice it leading up to labor. So open glottis pushing just allows you to push against a lengthened pelvic floor rather than one that is tight and tense and more susceptible to tearing because it isn't not able to lengthen and stretch while you push. Okay, so now what do you do with all 4 of these techniques? Really just set aside maybe 5 to 10 minutes per day, a couple times a week, to focus on different types of breathing. So the 360-degree diaphragmatic breathing where you're just lengthening your pelvic floor. Then you're gonna work on your open glottis pushing. Then you're gonna work on incorporating different movements to open different parts of your pelvis. Remember those 3 different levels. And then you're also going to practice getting into those different pushing positions. That way, the first time you're getting into that pushing position isn't in the labor room. You've actually been practicing at home, so now you feel more comfortable advocating for yourself to get into those positions in the labor room. These are the exact techniques I teach in my pregnancy and labor prep programs. It's not just about getting strong during pregnancy, which is important, but it's also learning about how to let go and work with your body, not against it. I will include a link for both of those programs in the description below.